As you start your journey with Medicare, it would be helpful if you know your ABCDs. That's because Medicare comes in alphabetical parts: Part A, Part B, Part C, and Part D. So when you fully understand each part, you can make better choices. Yes, I said choices plural. But don't let this decision process scare you. Let's begin by looking at Part A. You might think of it as major medical insurance that covers such things like inpatient hospital room, along with its ancillary services, skilled nursing care, and home health care. Almost everyone eligible for Medicare does not have to pay a premium for this coverage. Do you remember looking at your employee paycheck stub and noticing one of those deductions was for Medicare? Well, you paid for this benefit while you were working. However, if not, you can still obtain this part by paying a premium. Now, let's look at Part B. It covers doctor visits, outpatient ancillary services, durable medical equipment, and many preventive services. Enrolling in this part is optional. All beneficiaries pay a monthly premium, which is deducted from your Social Security check, or nowadays by monthly direct deposit. There is also a deductible for both Part A and Part B. For Part A, the deductible is for each episode of care, whereas Part B deductible is an annual one. Part A has no coinsurance for the first 60 days of service, whereas Part B has a 20% coinsurance for each service, except for some preventive services. So, in a nutshell, there you have Parts A and B. Both of these parts together are called Original Medicare, which are run by the federal government. Each time you receive Part A and/or Part B covered services, you'll receive a Medicare summary notice explaining payment amounts to providers, as well as your portion of the costs. If you choose Original Medicare for your healthcare coverage, then there are only a couple of other decisions to make. You have the option to take out a supplemental coverage to pay for deductibles, coinsurance, and some other services depending on the plan you choose. You pay a monthly premium for this coverage. Another choice you will need to make is whether or not to enroll in a prescription drug plan. However, you still have more choices. Now comes Part C, or commonly called Medicare Advantage. Some people call it Medicare Alternative because this type of coverage is offered by private insurance companies. The federal government approves each insurance company and provides the rules and guidelines so that you get the same coverage as Original Medicare. For various reasons, these insurance companies also provide several other services not provided in Original Medicare. If you choose to enroll in a Medicare Advantage plan, you also must be enrolled in Medicare Part B. After you receive your Medicare and You Handbook, take a look at the section called Medicare Health Plans in your state to review the choices for your area. You choose the plan yourself by signing up directly with them. The last of the Medicare alphabet is Part D. This part is commonly called the Prescription Drug Program, which helps pay for your prescription drugs. It is optional and is available to everyone enrolled in Original Medicare and most Medicare Advantage plans. To obtain this coverage, you are required to pay a monthly premium. The amount varies depending on the plan you choose.